All right, Commissioner, it's 4 o'clock now, so we may have a couple other counselors join, but we can jump right in, and the meeting is being recorded, so it'll be posted both for the public and for members to review later, should they choose to do so. And so, Commissioner, I just wanted to call this meeting. We had not met in some time, as much of the situation had remained somewhat static. And I know there haven't been a large number of announcements in the last few weeks, but I did see that the Board of Health had issued an advisory last week, and I know there were a couple of questions that we had talked about in our previous meetings that I wanted to revisit. So I did call the update for today, and so I thought perhaps, Commissioner, we could just start with an update from yourself relative to the statistics. And then the other pieces I have on here that I wanted to check in about were the home test kit expiration issue that we had previously discussed, and the status of testing in the community, as well as any communications we've had from DPH about the current status of the pandemic. So like I said, if you'd like, Commissioner, maybe we could just start with sort of some statistics that you think are relevant and go from there.
Certainly, and again, thank you, Councilor Letterman, for holding this meeting. The news is not good for the pandemic in the city of Springfield. For the last 7 weeks, we have seen our cases go up. I'm anticipating that trend will continue for the week coming up based on the data that I've seen so far from this week. So let me tell you, and I think you're aware that on March 30th, we had 71 cases, and that was 23 more than the week before. The week of March 27th, we increased to 115 cases, which was 44 more than the previous week. The week of April 3rd, we had 137, and we increased by 22 cases from the previous week. And then the week of April 10th, we had 218 cases, which is an increase of 81 cases over the prior week. And then the week of April 17th, we had 250 cases, which is 32 greater than the previous week. The week of April 24th, we had 350 cases, which is an increase of 100 cases over the prior week. And then the last week, I have a full week's worth of data for, we had 522 cases, which is 172 cases more than we had the week previous. So based on the data that I'm giving you, you can see that over the last 7 weeks, our cases have continued to rise. And I should say that that is not uncommon for the Commonwealth. Across the Commonwealth, we are seeing the COVID-19 cases increase. Let me talk a little bit about the vaccination rate. Certainly, I can give you more data around race, ethnicity, in terms of what we're seeing as far as the cases are concerned. So let me do that now. So last week, 36.8 of our cases were white. 19.9 of our cases were Black, 1.3 of our cases were Asian, 18.2% of our cases were Hispanic or Latinx, and 22.6 of our cases are unknown, which had no race attached to it. The 30 and under population last week was 40.8% of the cases. The 31 to 50 was 30.1% of our cases. And then 51 and older, 29.1% of our cases. And so we are seeing an increase again across the board, but certainly in the numbers that we're seeing. I want to just try to give you a sense of the age groups. So you have the ability to see that the younger age, well, I guess we can just go with that 30 and under, 40.8% of our cases.
Commissioner, is that because, I mean, these are just the numbers, of course, that we're getting from the state PCR testing. These don't reflect, any home kits or anything like that. So I think it more gives us a trend in the city, and we know that trend is up. I wonder too if a lot of the under 30 pieces, when they test in the schools, is that reported in this number?
I am not sure. Let me say that in the schools, they're doing pool testing in the classrooms. I have been in close contact with Jeannie Clancy and her team. I just spoke with her yesterday about our school strategy. I'm not going to go into that, Councilor Letterman, if you don't mind. They will be reporting to the school committee tonight. And so I don't want to get out ahead of them, but I am absolutely involved in their strategy. I know what they're thinking as far as moving forward is concerned. So I guess the overarching discussion is that there is a strategy. We are using data as far as the schools are concerned, and we're putting mitigation strategies in place based on data in each of the schools. And so it's a very specific strategy based on the number of cases that we might see in any given school. And where there are higher cases, there is a strategy that's put in place to focus on that particular school.
Yeah, we'll certainly see what the school committee has to say this evening. My thoughts relative to the numbers and the trends was just related to that would be some of the more official numbers we might be getting. Whereas if folks are testing at home and we're not aware, we're just most in contact, I think, with those school children. Would be my thoughts.
And I think to your point, I did send Jeannie. So the data we can cross-reference is really looking at those addresses and potentially having school department compare those addresses with what they're seeing as far as the schools are concerned, and so that we can at least paint a broader picture around addresses. But I think your question was whether or not we, there's a correlation between what we're seeing in schools and what we're seeing, from the home tests and PCR. So you're absolutely correct. The PCRs are what I'm getting through the Maven system. The home tests, obviously, as you know, we're not recording those. So what I'm giving you for data is certainly based on the PCR. That's
fine. And I do want to thank Councilor Govan has joined us. And Councilor Govan, I think you've probably picked up here where we are in the conversation. But just prior to your joining, the commissioner had shared that she's seen an increase in the PCR reported tests for the last 7 weeks, with the most recent week being 522 cases.
Yes, thank you very much. And that is concerning. So I appreciate that, Commissioner, that you're on top of this. Thank you. Thank you, Chairman.
Thank you, Councilor Govan. Commissioner, do you want to talk a little bit about the mask advisory that the board issued last week?
Certainly. The mask advisory, and I will also give you some more data around our vaccination rates, but the mask advisory was put in place last week based on 6 weeks of data and seeing those numbers go up. Obviously, you know that the last numbers that we got from the hospital, there were 81 who were hospitalized last week, and 1 that was in critical care. So what we're seeing is certainly hospitalizations, but not to the degree as far as critical outcomes are concerned that we saw in the early Omicron wave. So hospitalizations are going up as well. So the vaccination percentage for Springfield right now, we are fully vaccinated. The Commonwealth is 81.1% as far as fully vaccinated is concerned. The city of Springfield is currently at 66%. So we continue to be below the state. Let me just give you that 01128 has a 75% vaccination rate. 01129 has a 70% vaccination rate. 01103, 69% vaccination. 01118, 67%. 01104, 66%. 01119, 63%. 01107, 62%. 01108, 58%. 01109, 57%. 01105, 57%, and 01151, 54%. So those are the vaccination rates for our city by zip code.
Thank you, Commissioner. On the mask advisory, could you speak a little bit more about who specifically is being advised to mask and in what conditions?
Yes, Councilor Letterman. So our concern obviously is individuals, particularly over the age of 65, but certainly we try to advise individuals over at any age who may have chronic diseases, who may be immune compromised. So those individuals who are concerned about are those who have underlying conditions, who we are concerned, obviously, that should they become COVID impacted, that it could have a severely negative outcome on their health. That was issued just, again, based on the data that we're seeing and the numbers increasing in the city.
And for folks who are not immunocompromised, I feel like, just anecdotally, we're hearing about a lot more individuals testing positive on home tests, going through then varying levels of symptoms. I think what I've heard from a lot of folks is questions around just as a refresher, because I think we're seeing this increase. For folks who are not immunocompromised, who are experiencing mild or moderate symptoms, can we just go over again what they should do if they test positive on a home test kit, how long they should quarantine for? And I think that would be good to review.
Well, for city employees, let me say that we have a policy, and I'll go into the general public policy, that if a city employee tests positive at a home test, we require them to get a PCR test so that we are sure that home test is correct. There are false negatives. And so what we are advising the public, if you have a test that is positive, a home test, we are recommending that you follow up with the PCR test and that you potentially call your primary care physician to let them know that you have a positive test. While we talk about age groups and we talk about immune compromise and our concern, we are concerned about obviously the entire community. And having said that, it's just important that parents check with pediatricians and that primary care doctors are contacted, because even if you have a positive home test, that should be a part of your medical record. You need to let your doctor know, I tested positive. So even if that individual says, what are your symptoms? What are you feeling? You can articulate that, but also that should be a part of your medical record as well.
I know many folks, including myself, do not have primary care physicians. If you do not have a primary care physician, can you, for just general advice, if you're concerned, I know they had been discouraging folks from going to the ER unless they felt they were in immediate need. Can they contact either the Board of Health or the State Board of Health with just questions? Are there individuals they can talk to?
Yes, I mean, certainly our number 413-787-6741 can be transferred to one of our nurses. But overall, if you have a positive test, we are asking that you quarantine you isolate for 5 days and then test again on day 5. If that test is still positive, we would recommend that you continue to isolate for another 5 days, or you can also come out of isolation, but wear a face covering for those next 5 days. And so it really does depend on how that individual is feeling. Are there other family members in the house that are testing positive? So there are certainly mitigation strategies that we can put in place. We are still recommending hand washing, social distancing, and face coverings. We are at an advantage to a certain degree, Councilor Letterman, because we do have vaccines and we do know a lot more than we did 2.5 years ago. But this trend is the BA2 variant appears to be more transmissible than even the Omicron. And so we are seeing our numbers increase, and we just want to make sure the public knows that this pandemic is not over. It's something that we have to learn how to live with and how to take the appropriate actions to protect our health and our family.
I think that's why it's helpful to review some of this, because I know for some people going into until the last couple of weeks when folks started seeing the surge again, they may not have been thinking about it as much. And so then, you get that positive result, and it's helpful for us to be able to share with folks that information. I wanted to check in about our latest guidance on boosters, but before that, Councilor Govan, because I've been going on over here. Did you have any questions for the commissioner today?
I actually did. Commissioner, as you know, we've been having our vaccine clinics out here in Indian Orchard, and it just bothers me that our numbers are still so low. So only 53%, I think you said. So we're going to continue to do that. We had a youth fair, a youth health and wellness fair the other day, and we were trying to encourage those vaccinated. The youth that came, some of them did get vaccinated, but they weren't from Indian Orchard. So that was kind of disheartening. And then we were supposed to have a vaccine clinic at the cruise night, but then it rained, so we didn't have it. So I'm just wondering is there anything else that we could do to try to encourage, more people in Indian Orchard to get vaccinated?
Councilor Govan, you all have done an excellent job. I mean, we've made the vaccines available. They're easy to access. We have plenty, we have vaccines so that people can access them. You are doing an amazing job trying to do outreach to the residents in Indian Orchard. So I would say, that you're doing what we're recommending, I guess, is what I would say. It's important that we continue just to try to hammer that message that the pandemic is not over. Please get vaccinated, please get boosted, but you're doing that. So you're doing an excellent job. I think one of the things that we're reminding our residents is that if you're in gatherings where you are in close proximities to individuals, understand that you should be wearing a face covering if you can't maintain a 3 feet distance. I guess we're pushing those messages out and you're helping us. So thank you.
Thank you. That was all I had. Thank you, Chairman Letterman.
Thank you, Councilor Govan. And I just wanted to say you are doing an excellent job out there in Ward 8, not just with relation to this, but I feel like there's a city meeting in Ward 8 every week since you took office, and that's how it should be. So much appreciation to you and your team. Commissioner, just a couple more questions while we have you relative to the boosters. I know when we had last met, they had the CDC had just authorized the possibility of a 4th booster. Have we gotten any more guidance from the state at this time about boosters and shots beyond 3 shots?
So the guidance really does say if you are 5 months out from having your first booster, then you're eligible for the second one. So there isn't specific guidance that's changed. Obviously, the second booster is recommended at this point for all individuals over the age of 50, particularly to get that second booster. Boosters are going very slowly across the Commonwealth, not just in the city of Springfield. We're not seeing individuals rushing out to get their booster at this point. We do have individuals, obviously, who are getting boosters, and our I'm just trying to see if they gave us our data for second dose boosters. They still are only reporting one booster. So seniors fully vaccinated with one booster is only 50%. Adults with 2 conditions fully vaccinated with booster, 28%. Adults with 1 condition fully boosted, 21%. This is, and then all other adults 16 to 24 fully vaccinated with booster is only 14%. And then children fully vaccinated with booster. And the children number is probably something that we should not, really drill down on, because we started that process later than we did with the adults. But as you can see by that, and this is the vaccination percentage. I should also say that this data is for Mass Health members, because we look at our Mass Health members and just want to make sure that they are accessing all of what we have available. And that data is through April 27th, 22.
So that fourth booster, that's only relevant to individuals 50 and older if they would like to, and they are 5 months out.
That is the recommendation. It started out with the individuals with chronic conditions, immune compromised, and then the CDC did change it to individuals over the age of 50 can get that second booster.
Okay. Last question I had for today, Commissioner, is relative to the home health, the home test kits. I know that we had talked about, we still have a store of them. They do have an expiration date on them, and actually a constituent reached out to me about that the other day. I'm looking at one of the ones that I have that I got from the health department that says used by 7/2/2022, so July 2nd. So there's still some time on this one. Are they all expiring in July allegedly? And do we know what that means, the expiration? Do we know if they can still be used past that date, or have we gotten any guidance on that?
We have, but we in the department have test kits. Are you looking internally to the test kit, or are you looking externally on the box?
This is just the on the box.
Okay. So we do have test kits that are expiring in May. So we are going to be obviously making sure that we continue to push those out. We will be giving them out at the pancake breakfast just to make sure, and telling folks that, they expire in a couple of weeks. So we will be recommending. It is our understanding that the May expiration date, and I'm going to have to follow this up, those test kits can be used into July. But, that is not something I would definitely tell our constituents or our residents. The box says is May. Now, we do have other test kits that are expiring in June and July. So we want to make sure we're getting those May ones out, and then June, and then July.
Okay. All right. Only other thing I had on here was just, have we gotten any new communications from DPH or Bay State about any impending crisis related to all of this?
No, as I said, the Bay State numbers were 81 and 1 in critical care, but I have not received any guidance from Bay State and or Mercy Medical Center, Trinity Health, about any concerns that they have. As you know, the Bay State patients are really spread out throughout their system. The flagship at last week had 56 in it, and the remainder were at Wing and Franklin, if I'm not mistaken. But we have not gotten anything that's saying that they're in a crisis. Certainly, staffing continues to be a challenge, Counselor. They are still down about 1,400 positions, and they are trying to recruit to make sure that they're able to take care of the patients in their hospitals.
Understood. All right, Commissioner. Well, I thank you so much for your willingness, as always, to update the council. And Councilor Govan, did you have any other questions?
Thank you so much. Thank you, Commissioner, for all the work you're doing.
And thank you, Councilor Govan, for being our partner. It is imperative that elected officials use their platform in order to help us increase these vaccination rates. So I'm very appreciative for you. And certainly, Councilor Letterman, your leadership has been invaluable. So thank you both very much.
Thank you, Commissioner. We will we'll check in again in a little while. And as always, don't hesitate to reach out to us.
Thank you. Have a good evening.
Thank you,
All right.
everybody.
Maybe I'll see you at the pancake breakfast.
I will be there.
Our youth are doing a day of health and wellness as well on the riverfront that day. And so please stop by there. Lots going on. We're doing yoga. Our youth vax force decided they didn't want to just focus on COVID. They wanted to do overall health and wellness. And I think that that's what happened in Indian Orchard. So I know I will see you all someplace on
I do have
Saturday.
that on the calendar as well. So
We're also doing our community baby shower at the High School of Commerce at 10 o'clock. The department does a community baby shower where we do giveaways for parents and parenting individuals. And so it's going to be a full day for all of us, but I know that I'll look forward to seeing you all. So thank you and have a good evening.
Thanks, Commissioner. Thank your staff for us as well.
Certainly will. Certainly will.